Okay. Well, welcome everybody to our meeting. It's the last one of the semester, so happy and sad. Um, this month we've been going over chronic pain and a lot of different disorders that go along with it. So as always, our disclaimers, this is not medical advice. And if you're concerned about any of the conditions we're talking about or any of these issues, please talk to your doctor. And these patients' experiences do not represent everyone with their condition. As we all know, pain is a spectrum. And we'll be learning more about their experiences today. So some takeaways from our 2 weeks ago now. 2 weeks ago, we had a presentation on chronic pain. And chronic pain is defined as pain that's continuing past when it should, lasting at least 3 months, and it can be on and off or continuous. If it's continuous, it's intractable pain. One of the conditions we went over was fibromyalgia, and it's a disorder where the main symptom is having painful sensations that are amplified because the way the brain and spinal cord process pain signals has been affected in some way. And CRPS is a broad term for a form of pain that follows an injury with disproportionately prolonged pain and inflammation. And it usually affects the arm or the leg, any part of your limbs, and it can be acute or chronic. And central pain syndrome is a rare chronic pain neurological condition that's caused by damage and dysfunction of the central nervous system, the CNS. So if anyone has any questions about any of those, feel free to ask them at any time, either in the chat or raising your hand. But we have some special guests joining us today.
Yes, thank you very much to our special guests. So we have Alyssa, Katie, Alexa, and Maura.
So we're going to do this as kind of a Q&A style roundtable. So if anyone wants to start off with the first question, what's your experience with chronic pain? What's your diagnosis, if you're comfortable sharing, and how does it affect you?
I can start. Hi, I'm Alexa. I'm from Michigan, and I have central pain syndrome. Mine started, I got mine 6 years ago from a bad car accident, like 2 months after I graduated college. It took me about a year to be diagnosed because they kind of have to rule everything out. And I'm in constant pain 24/7. Normal everyday touch can really affect me. And like it could be like cold. I get goosebumps, and normally goosebumps are just like they're kind of annoying, but mine, I'd rather rip my skin off than dealing with them. I've had seizure-like symptoms that were actually from because I had so much emotion and so much was going on, my brain couldn't handle it, and it took it out. My emotions came out from in these like spasm type forms. I was able to get out of that, which has been nice. It's been a really bad 6 years, and I'm finally at a place with a new medication that I'm actually able to live a semi-normal life. But it's been really hard, and I've had doctors telling me it was in my head and that I was crazy. I had doctors telling me that I was doctor shopping to get my answer I want to hear. And you know what the truth is? Yes, I might have been doctor shopping, but it's not to get an answer I want to hear. I want an actual answer, not that, oh, I can be cured in 4 to 6 weeks by walking. And then when I didn't, he's like, oh, well, that's on you. Like, so it's just very important, not only for people with the chronic pain, but even people like as caregivers or just people in your circle to understand it the best that they can and just be compassionate.
Definitely. Alyssa, do you want to go next?
So my name's Alyssa. I'm actually a Loyola student. I have been diagnosed with both small fiber neuropathy as well as fibromyalgia and a slew of other different issues, but the two related to chronic pain are small fiber neuropathy and fibromyalgia. I started experiencing symptoms probably around 4, maybe 5 years ago, and had always been fairly active, never had like any injuries, stuff like that. And it all started with just a lot of lower back pain that was to the point where I could not function. I was leaving classes constantly to go sleep in the nurse's office, stuff like that. After being told for years that it was bulging disc or a million other um, different things, I finally found a doctor and medication stuff that actually are helping me. I still experience things like flare-ups, which for me look more of fatigue. I get weakness and numbness in my lower extremities, but my upper extremities are constant like stabbing pain. Still the lower back pain. I have a lot of hot and cold sensitivity. So whether it's the temperature outside, me being near a pot when cooking, or even just like getting overheated from having a blanket on me while at night, I experience that a lot, as well as like having issues regulating my body temperature too. And that's all caused by these two medical conditions. Um, and it took me up until the last year and a half or so to be fully diagnosed, but I have had to switch medications and therapies and stuff multiple times over this last year and a half because drug reactions, as well as just my body can't handle certain medications. So yeah.
Katie, do you want to go?
Hi, y'all. I'm from Yelensville, North Carolina. I have multiple chronic illnesses, but in regards to pain, the three main ones I have is CRPS, small fiber neuropathy, and EDS type 3. I also have temporary paralysis and twitches that come and go from time to time. For me, the pain is there always, just some days are worse than others, and it can happen anywhere in my body. It started out in my right leg and has spread all over my body, and my chronic pain interferes with my daily activities such as working, having a social life, and taking care of myself. Pain also interferes with my sleeping, and I just take it day to day and live life to the fullest. For CRPS, I was in a minor car accident that helped lead to the diagnosis. And for small fiber neuropathy, I had a lot of tingling and other issues after a surgery, and that was found after a battery of tests. I've had CRPS since I was 16 years old, and I'm currently 22. EDS is a connective tissue disorder that I was born with. However, I didn't find out I had it until I was 18 years old. Small fiber neuropathy was diagnosed 2 years ago when I was 20, and it has gradually gotten worse over the past 2 years. CRPS, it took me a year to get diagnosed, small fiber neuropathy 3 years, and EDS 5 years. I've tried a battery of treatments and nothing has worked. And I can't do anything to stop any of the pain that I'm in. If it gets to the point where it's too bad, I have to go to the emergency room. But other than that, there's nothing really that they can do for me.
All right, Maura, you are up.
Hi, so obviously my name is Maura. My main diagnosis is Ehlers-Danlos syndrome type 3 or hypermobile Ehlers-Danlos syndrome. And that kind of has caused all the other conditions that give me pain, such as Chiari malformation. Doesn't give me pain anymore, but that was my first experience with chronic pain. Tethered cord syndrome. And yeah, so EDS, tethered cord syndrome, and Chiari are kind of my main diagnoses. Pain-wise, I first started experiencing chronic pain when I was about 6 years old, and that was in regards to the Chiari. Really, really bad headaches, like the worst headache you could imagine. It felt like it took a while to get diagnosed, but from what I was told, because I was sick, so I don't remember much, and it only took a couple months, maybe a month. I was told my mom was told it was just migraines, but she took me to a neurologist because she knew something else was going on, and she was right. And then EDS kind of came along actually after the Chiari surgery. I had surgery for the Chiari, and I started having a lot of neck pain and a lot of head pain. And I saw some specialists who knew about EDS and craniocervical instability, and they recognized those signs and symptoms. So in regards to my neck, I've had at least 4, if not more, fusions in my neck right now. I'm fused skull to C6. Each surgery has gotten me to a point where I can somewhat function. If I was completely bedbound, it has improved my quality of life to where I can sit up for at least a couple hours, but it has in no means it has been no means taken away the chronic pain in my neck. It's kind of gotten worse over time. I feel like the surgeries have kind of become less effective in the neck pain itself. Sometimes it helps with, I get nerve pain up and down my arms. It will help with that, but not so much the actual neck pain. So I'm constantly in a lot of pain from that. As you can see, I wear this cool brace that's bedazzled. And that kind of helps for when I'm upright for more than about 20 minutes, just so I can focus on the task at hand and not the pain, though I'm trying to wean off it, and tethered cord syndrome. That diagnosis took a while because I attributed a lot of the symptoms to my neck because I was having a lot of neck pain and I was having a lot of leg pain, and I said the two have to be connected somehow. Doctors agreed. We didn't really connect the dots until I was 3 weeks into my freshman year of college, and I lost the ability to walk, like out of nowhere. A lot of tests, and then we found out it was tethered cord syndrome. I had a surgery for it. Things improved from that aspect. And about a year later, I started showing signs of retethering. It took another year-ish to get that diagnosed because I was told it was really rare to retether that early, even by the doctors I really trusted and who are still really amazing, but they just couldn't see how it could happen so quickly. And mine, unfortunately, did not show up on imaging. It was occult, so meaning you couldn't see it on an MRI. So I had to go to Rhode Island to see a specialist to get that officially diagnosed and treated. Before the surgery, it was an increased level of pain than what I have now, but I still have a lot of muscle spasms in my legs. So I take a muscle relaxant for that. And I have some nerve pain occasionally in my legs. And yeah, I guess that's it. I don't want to talk for too long.
And for those who don't know, can you briefly explain what cervical instability and tethered cord syndrome is?
Yes, I'm sorry. So cervical instability and craniocervical instability is essentially, especially with EDS, my ligaments aren't really good at holding the vertebrae in the right place. So for instance, with craniocervical instability, my brainstem was actually being compressed by the C1, C2 area, and my skull was just not holding, neck was not holding its head up. Some people liken it to like being a bobblehead because there's just no support. And with tethered cord, it's exactly what it sounds like. Your spinal cord is tethered essentially to the phylum terminal. That's what it's called. And in some cases, the phylum terminal can be fatty or thickened. It can be occult, meaning you can't see it on an MRI, which has been my case, or it can be a classic tethered cord where you do a lumbar MRI and it's very apparent. However, the symptoms of both are identical. It unfortunately, there's just a lot less doctors who treat the occult kind, because it's kind of crazy when you can't see something on imaging, but when you cut someone open for the surgery, it's right in front of your eyes. So yeah.
And I'll ask, can you briefly explain what Chiari is?
Yeah. So Chiari is when the base of the, sorry, brain fog. When the cerebellum sinks down, it's supposed to be contained in your skull, but mine is not. It sinks down in past like the base of the skull and presses on the brainstem. It blocks cerebral spinal fluid, which your body naturally produces. So the main goal of the surgery that I had when I was 6 was to create enough room for that fluid, the cerebral spinal fluid, to flow. It did not put my brain back in the right place. You cannot do that. But what it did was just make it so that fluid wasn't building up. And it lessened brainstem compression, but my brain is still like not, you know, like everyone else's brain anatomically. And the cerebellum controls motor function and balance. Yeah.
Awesome. Thank you. Okay.
Can I actually ask a question?
Yes, of course.
To all the speakers, just because like I'm always curious about this. When you guys were all being diagnosed, how were like the doctors? Like, did you have doctors? Like my situation where at first I had doctors that thought I was crazy, or because mine for central pain, it doesn't always show up. A lot of times, if anyone knows what MS is, I call it like the copycat. Central pain is very similar to MS. It just doesn't technically get worse over time, and it doesn't have lesions per se in the brain, but it can be really hard to diagnose. So I'm just curious, like how everyone else's like doctors' experiences were leading up to getting diagnosed.
That's a really good question.
So Chiari, other than being told it was just migraines, we didn't have too many issues because my mom was able to take me to a neurologist that she trusted pretty quickly. That's the word. I'm sorry, I've been doing finals all week because this week is my finals. So my brain is fried. The question was
Good.
Did you have like a good set of doctors?
Oh,
or like,
I did.
Take a while to find.
Craniocervical instability. That was a beast to get diagnosed. I had a doctor, and I must have been like 10 or so, and he told my mom that I was faking it for attention. I couldn't possibly, and mind you, I was in a reclining wheelchair, unable to sit up because of vertigo and chronic headaches, and I couldn't be a kid, but I had to be faking it for attention, right? Like, tethered cord syndrome. I had a hospitalization to rule out anything, other than tethered cord, because we didn't suspect it at first. And there were some doctors who, were like, is it stress? But I was very, it was a good thing that I had a doctor that was able to advocate for me and like kind of steer them in the right direction at that hospital. My primary care is at that hospital, so they kind of steered them in the right direction. But there was a physical therapist who my mom heard outside the room, and I didn't know until after the fact, which is a good thing because I would have had a lot of attitude towards him, or at least internal attitude, who apparently said to the nurse or someone at the nursing station, oh, was that the patient who refuses to walk? Because on paper, there was nothing that was wrong with me. But obviously you weren't able to see it with the MRI. So I've had good doctors, but it took a really long time to find those good doctors.
Mine were like that. Like all my doctors now are amazing, but it took me about a good year.
So I've had to go travel out of state all the way to Cleveland, Ohio, and Dover, New Hampshire. I've had people, I have autism, so they look at that and think, oh, well, it's all in her head. And they use that more because I have another type of neurological issue, and they want to blame it all on that. And everything is not autism and not anxiety. And I feel like they use that as a label more than a diagnosis. And I've gone through a lot of terrible experiences with doctors, in state and out of state. And I went through 5 neurologists before I went to New Hampshire. And now insurance is not approving the treatment that she used for cystic fibrosis patients. But I'm an off the label case.
So for me, I kind of what you said earlier, like doctor shopped a little bit. I had a couple doctors just blatantly ignore symptoms. I had one try and tell me that I needed to be induced into a psych institution because she thought I was crazy and making up stuff. And it's just been kind of a struggle. I finally have a team now that I really trust and really like, they know me really well, so they know I'm not doing any of this stuff that other doctors were saying. But it just took a long time out of it. And then it's not my first time experiencing it. I've had it happen in the past before, especially during chronic pain hospitalizations, where I've had doctors just tell me, oh no, we can't do anything for you because this isn't a real diagnosis or this is not a real disease.
Yes, sadly, that sort of experience is an all too common thing.
Yeah, unfortunately, medical gaslighting is very prevalent, especially in the chronic illness realm.
Yep, especially when it comes to pain, since there's nothing that can, truly show pain. Then it's
And another thing I noticed too, and I'm not trying to like stereotype or anything, but a lot of times it's male doctors and female patients.
Yep.
No, that's not stereotyping at all.
There's been amazing.
No, that's not stereotyping at all. There's stats to back that.
Yeah, that's what it is.
Female presenting people do not get taken as seriously as men do in medical realm. That's very true. Especially children, which is unfortunate. Oftentimes people think children are making it up for attention, but it's like they really have no reason to, unless there's like extreme family distress at home or any other abusive situation. It's like if you have none of that, then there's really no reason to be accusing a child of faking their pain.
And I think even when they because they use the what's the medical condition where hypochondria?
Yes.
But
hypochondriacs.
Yeah. Okay, 2 things about that. 2, that's actually still a medical condition. Like people, I don't think they're trying to do it on purpose. It's still like a mental, like they just might have a more of a mental issue on that end. But that also makes it hard for us that aren't actually trying to get attention and are just trying, like a lot of you guys talking were a lot younger. Like I'm probably the oldest of being diagnosed. I was 22 when I was diagnosed, but like I had the doctor telling me like, oh, you should be jumping for joy, not crying. Like you're a healthy, normal girl. I can't have a 10 out of 10 pain. And I'm like, I just graduated college. Like I should have this whole life ahead of me. Like, why would I be making this up? And like Maura, who was 6, or like, who would be making this? Like, I just can't picture them making it up. And the people that do, there's obviously a condition though. Like hypochondriacs, it's a condition that needs some kind of help. It's just.
Yeah, definitely. And I personally have been, have said that I have Munchausen's by proxy because I was a high school kid who, couldn't attend high school mostly because of pain, but also all of my other conditions. And they tried to truancy me and, arrest my parents. And I know people who have had that happen to them.
Yeah,
Scary.
not as extreme, but my parents were called. I missed like close to 50 days in middle school. I missed like 2 years of high school. But after like the first couple of weeks and we've had doctor's notes and all that stuff, they kept calling and being like, "Well, your child really should be in school and like you should be wanting them to have an education." And we're like, pardon. So yeah, anyway, we're getting a little off track, but
Sorry,
back
that was
into
all my
no
fault.
no no that's good conversation, very good conversation.
I
um
want to point out one thing. A lot of times, I mean, it's not necessarily a lot of times, but at least from people that I know who have experienced similar things, they are the ones who, want to be in school. They're the ones who are, love school. And I was like, yeah, I've gotten basically straight A's and I love school, but yet I'm faking an illness to miss school.
yeah, I never quite understood that one, especially in terms of like, oh, I don't get to see my friends, I don't get to do the things that I want to do as a normal child. I'm totally making it up so I don't have any friends anymore. Like,
What are you doing at home? You're probably sleeping or you're crying because you're in pain. You're not
Yeah.
just sitting and watching TV all day, like,
mhm,
or if you are, you're probably not in the mood for it. Like, you don't actually want to be.
mhm.
I was in the ER on my 18th birthday, and they called in the psych people and held me.
Oh, I am so
Who
sorry,
would want
guys.
to be on your birthday? I mean, anytime, but
Yeah,
why would you go on
Mhm.
pick your birthday?
Yeah.
it's
I'm sorry. I just get very mad about all
no,
this
it's
from my
very
own
valid.
experiences and then hearing other people's. I get
No,
very
it's very
angry.
valid. One of the many reasons why I am pre-med. Okay, so back into some of the questions. I know some of you guys already answered some of these. We started like getting into them. So for those of you who have not answered yet, what made your doctor suspect that you have the conditions you do? When did you start experiencing symptoms, and how long did it take to get diagnosed? I think most of you have said this already, but any additional comments regarding those?
I actually diagnosed myself kind of. When I had a cranial sacral therapist for physical therapy, and she had said she feels a lot of the stuff in my thalamus and my central area. And I ended up deciding for fun to look it up because I wasn't one to like look up a cough and then, oh, I have all these conditions. It was more like if I have something, like I'm kind of trying to understand it. And the minute the first thing came up was central pain. And a month or so later, I went to I went to my new doctor and we were talking about everything. And I said, is there a chance that it's central pain syndrome? And she said, I think it is. So I kind of had diagnosed myself in a way, but she agreed.
Yeah, with the tethered cord, the initial hospital was pretty useless, to be completely honest. I don't want to be mean, but they couldn't do much. But I have a neurosurgeon who primarily works on my neck, but knows of occult tethered cord syndrome and believes in it. We called him obviously and kind of went through all my symptoms. And he set up a few tests like a urodynamic study. And it turns out that I had all these things I didn't even know were symptoms, because we always feel these weird sensations in our body and it's like, oh, it's a new thing. And I was like, oh, that's not a normal thing like to happen. Like I'm getting way off topic here, but I literally remember having to like lay down on the floor and rest for a second when playing Barbies because my back would hurt, or like just from trying to support itself, since EDS, our ligaments are useless, so our muscles have to overwork, and I'm sure tethered cord had something to do with that too. And I thought it was normal. I thought that was just being tired, like everyone got tired playing Barbies. But yeah, that was, and Kiari, it was just the headaches. EDS, it was a lot of kind of moving parts. And honestly, even with my tethered cord diagnosis, and I was an adult for that, my mom was a huge part of me getting diagnosed because I was a kid for a lot of it. So she was and still is a huge advocate for me.
Having someone else to speak up for you, definitely a good thing.
Especially when you can't yourself at that age.
Mhm. Especially also if you have brain fog and other things that may cause you to forget what the doctor has said.
Yeah, my mom goes to almost all my new appointments.
Yeah, I feel that.
Yeah, I'm
And
the
I'm
same way.
27, but
Yeah, no, I'm the same way, especially with brain fog, as well as just like it being new appointments. I always have someone go with me because the amount of times I've left a doctor's office and not remember a single thing we had like talked about has happened multiple times before. But for me, doctors originally, besides like bulging discs and stuff like that, they had suspected maybe either lupus, EDS, or MS for me, all of which, after doing every single test imaginable, came back as not prevalent to me, just because although I do have some symptoms of those conditions, they don't line up properly with the medical test, as well as like some of the other like treatment options. I think that's the right way to say that.
a lot of chronic pain conditions kind of mimic other illnesses too. So it could make it look like it's that, but then when you get tested, it's not.
Exactly. We've talked about in our meetings how some of the conditions we're talking about have very similar symptoms and lots of overlapping symptoms. And when you have multiple things, you can't really tell what symptoms go with what. It's unfortunately one of the realities of living with multiple chronic illnesses.
I actually was just diagnosed, I forgot to even say this, with IC, interstitial cystitis, painful bladder syndrome. So I actually went to the gyno like 4 times in a year, thinking I had bladder infections. And each time it wasn't. And it actually mimics the bladder infection. So I get all the symptoms, but it's just stress or certain foods that trigger it, but it's not any of that. So I always feel like the boy who cried wolf, but I'm not.
Definitely understand that. So for those of you who've had treatment options that have worked or not work, which is everyone, I don't know why I phrased it like that, but if you guys would like to share some treatments you've tried and what worked and what didn't, and like what in general helps your symptoms and what makes them worse.
Oh, go ahead.
You go, Maura. You go.
I forgot what I was gonna say. Oh, so for the relevant diagnoses like Chiari and tethered cord, when other symptoms like being unable to walk, or things like that, the surgeries typically at least lessened or took away the pain. But with EDS and my neck pain, I've also tried all like the nerve pain medications, so like gabapentin, Cymbalta, Lyrica. I literally, and now it's bad for you, but I told my doctors about it. I take Tylenol and Aleve on a daily basis, just because it knocks the pain down a little bit, especially the Aleve. And I need anything, any tiny pain relief I can get. I need to be able to like live my life. What else? Muscle relaxers are a big thing for me because having a bunch of metal in your neck and it being cut open several times and tends to make things angry, on top of I still have instability, or can like my lower C6, C7 isn't great. It's not bad, but it's certainly not normal. So that also causes muscle spasms and pain. So the neck brace, the muscle relaxers, nerve pain medications, and things like that. And a lot of the medications I'll like recycle through for different problems. Gabapentin for nerve pain associated with my cervical instability, and tethered cord works great for nerve pain, but it didn't do a thing for my Chiari headaches because it wasn't a nerve pain situation. So yeah, that was kind of all I got.
So I've tried a little bit of everything for my pain, from aqua therapy, biofeedback, essential oils to narcotics and non-narcotics, and nothing works. Um, Things that make it worse is anytime I'm sitting for long extended periods of time, using a hospital wheelchair or my non-custom wheelchair, swimming because my legs will turn bright red or go paralyzed. And that's the same for taking a shower. And wind or anything rubbing against it, so I can't wear blue jeans or shorts.
For mine, for the longest time, I couldn't find anything. I went through all the gabapentin, Lyrica. My symptoms or the side effects were worse than my symptoms. So it just wasn't worth it to me. I did all the physical therapies. I've done a lot. I recently just started, I had done a ketamine infusions, 2 of them. And now I'm on Medtine. I can't pronounce it, but it's like a form of, and that has been a life changer. I've been doing a lot better. Like I'm actually able to like focus more and like handle, my body can handle more. Also like thinking more positive in life, and like walking has helped. Like when I'm in pain, like some days I'll just go for a walk and it kind of like stretches my body out. And like actually as of this week, I've started doing a whole like habit pattern, like going to bed at the same time, getting up at the same time, like journaling, meditate, like doing all this kind of stuff. And it's been, and drinking a lot of water, and it's been like doing pretty well. Like I still have a lot of bad days, but they're a lot less than they were.
I wish I could do ketamine, but I'm not a candidate because I have mast cell activation syndrome. So I would react.
Yep.
I was actually supposed to maybe get a like a stimulator in my back.
Mm-hmm.
And the doctors, when I went, I had to go talk to a psychologist and everything first. And they had said, we want you to try this ketamine infusion first.
Mm-hmm.
And if it doesn't help at all, then we'll go back to that. But if it ended up helping, but I had never thought of, I mean, no one had ever told me that about what I had done lidocaine infusions, and then that medication, and that medication was more known for arrhythmia.
Mm-hmm.
So I had to, like, for the first 3 weeks, I actually had to get like EEGs every week. No, not EKGs. And I think it actually slowed my heart rate down a little bit, and I got really sick. So I ended up getting off of it. But this has been the one that's actually helped somewhat.
Glad you have found something.
It's been a long time, so I'm happy.
For me, I've tried a slew of different medications. I tried cognitive behavioral therapy for a while, which did not really work for me, because trying to do talk therapy just for me isn't it. I've been told like you could try doing stretching, exercise, and stuff like that, but with some of the other health conditions I have, doing those things are extremely hard. So it's not necessarily like the medication doesn't necessarily help alleviate all the symptoms, but at least helps me maintain like less flare-up days. I have tried doing, I have like the portable stim machine as well as like heating pads. And the stim machine at least allows me to be able to make it through classes on a day-to-day basis, or even make it through like a shift at work, stuff like that. But nothing really helps, nothing that I like could think of makes it worse compared to what it is on a normal basis. It just kind of happens that way. I did notice though that I do take muscle relaxers as well as some other meds. Muscle relaxers mainly because spasms are extremely bad for me too. But I'm allergic to most pain, like heavy pain medications. And like Advil, Aleve, all that stuff does not work for me either. So if the pain does get too bad, I do tend to have to be hospitalized, because then at least they could figure out, like, not figure out, but like manage my reactions as well as the pain at the same time, to at least get it to the point where I could go home and deal with it the rest of the way.
Something I forgot to mention, as far as what helps, heat helps my muscles. I sleep with 3 heating pads on to go to bed, to kind of just like chill the pain out and chill my body out. One for my legs, and I have rested on like a little fluffy pillow, one for my neck and one for my back, and then I have some ice packs thrown in there because I get overheated if I don't throw ice packs in there, and it's also nice for my upper back. So heat is a huge thing for me. And when I'm out and about, I actually have, let me see, I have it right here. I have a portable heating pad. And I just put it in my purse or bag. And it's this like little rechargeable thing I carried around with me. That does not fit under my brace, but it works for things like my back or my stomach, because I have some GI issues. But I also have stick-on heat packs that I fit under my brace, and I use when I'm on campus, like in class, and have to sit up for like an hour. So yeah, I'm a heat addict. Yeah, I just wanted to add that because I forgot how much of a huge thing heat is for me. Like, it doesn't take it away, but it can make it more bearable, and sometimes fend off migraine like headaches that I get from my neck muscles being so tight.
Have you tried a heated blanket?
I have, but I think it's just so much heat that it makes me overheated.
Gotcha.
Yeah.
Let's move on to our next question. What has your chronic pain condition changed for you?
I've become my own advocate. I've learned that I have to trust myself over anybody, including doctors. Not that doctors aren't great, but for the ones that aren't, I've learned to have strength and a voice.
For me, my perspective and outlook on life, it has made me branch out and try new things I wouldn't otherwise probably had the chance to do. I am currently the 2022 North Carolina Miss Agriculture Advocacy Ambassador and the 2022 North Carolina People's Choice Miss United States Agriculture, and this is something that I thought I wouldn't do in 1,000 years. But in June, I will become the first contestant in a wheelchair to compete in this pageant, and this is something that's truly remarkable. And I also have a passion for helping others through my nonprofit, Smiling While Sending Hope, for people ages 0 to 26 living with chronic illnesses and special needs.
That's amazing.
Mhm.
Yeah. Awesome.
For me, I used to be extremely active. That has been kind of hard with the chronic pain, but I've chose to kind of look at each day as like a new opportunity, and have definitely stepped outside my box a lot more than I would have. I've tried going and just doing new things that me as a kid or a high schooler wouldn't have imagined doing or wouldn't have thought about doing. But I definitely look at it as more of a learning opportunity and something to, sorry, brain frog. I look at it as more of like a learning opportunity and something that, yeah, it's a shitty situation, some people think, but I look at it as that's just kind of my deck of cards that I've been dealt, and I look at it as a way of teaching others, because besides doing more of like self-advocacy stuff, I also am really interested in working with kids with IDDs and chronic illnesses. So I hope being like a pre-med student, I could use that in the future more.
Yeah, so for me, that's a slightly harder question because the majority of my life that I can remember, chronic pain has been somewhat a part of it to varying levels, because there have been brief periods of time where I've had minimal to no pain. But I'd say the biggest thing is it's made me a lot more compassionate towards people, and that might sound cheesy, but it has. I don't know, I just care a lot more about people. It's made me want to go into the child life specialist field. So I'm studying for that right now. Because I know, like, especially since I experienced chronic pain more as a child, child life specialists were such a huge help, especially like when you had mean doctors. They're very rarely mean child life specialists. So I want to be that person, I guess, for other kids experiencing similar situations. Yeah, that's kind of all I have to say about that.
That's awesome. So we're going to group two questions together. If the public were to know one thing about your chronic pain condition, what would you want it to be? And if doctors as a whole were to know one thing about your chronic pain condition, what would it be?
For me, I don't know that it's necessarily about the condition, because I'm still learning about it. I think it's the compassion piece, and that just because you can't see it doesn't mean it isn't there. And I think especially for doctors, if they could just listen even sometimes and just be there for the patient. Maybe they can't help them at that moment, and that's okay. Like, we can't expect miracles, but if they could at least show that they care and that they really do want to help, and even if that's sending you to a different doctor, but don't just jump because your ego can't handle not helping. Don't just put it on the patient. Do what you can to help.
Definitely. That reminds me of our doctor speaker last week, who was I don't know his exact words, but very similar thing, where he was saying, if your doctor who, can't treat a patient, tell them, hey, I can't do anything helpful for you, but here's a doctor who can. And
I had a neurologist that did that, and that I was thankful for that.
Say, I can't do this. I'll find you someone who can.
Yeah.
Not one doctor can be a specialist in everything.
Right. But at least being humble enough to be like, I can't help you, but I'm going to help you find someone that can.
Yeah. Actually, I call him my main neurosurgeon because he's done pretty much everything but my second tethered cord surgery. My main neurosurgeon really didn't know what to do with a retether that you couldn't see on an MRI. All he had was my word, and he was like, I believe you. I believe you're that. Like, he didn't try to make me feel like it was in my head, but he just didn't know what to do. Unfortunately, he didn't know who to refer me to, but the EDS community Facebook group, I found a doctor. And I guess what I'd want doctors to know, or people in general to know, is it was right there and it just floated out of my brain. So if anyone has an answer, go ahead, because I have a feeling this might take a while.
Go ahead, Katie.
Just because someone is disabled doesn't mean they can't do something. They just might have to adapt in a different way.
Definitely.
Amen to that.
strictly doctors, because this isn't really applicable to other people. Imaging isn't the end all be all. There's a lot of things that don't show up on imaging, or if they show up, it doesn't look nearly as bad as it is, or it can cause worse symptoms than you'd think it would. And I guess as far as people, like, yeah, we have these conditions, and whether they're invisible, or sometimes I wear my brace and stuff and I get funny looks, but we're normal people. We are not aliens from another planet. We have limits. We're not lazy, I think, is a huge thing, because I think some people like will see me like resting, and I had one comment and she's like, you just study and rest. I'm like, yeah, because that's what I can manage right now. So yeah, that's what
One more one more thing. Just because we know our bodies the most, and they see us all a few minutes, an hour at most, and there's no way for them to get the whole picture on what someone feels on a day-to-day life. So they need to have empathy and compassion for us, and not say they or just be rude to us. Like we're
Definitely.
I would say you guys basically hit everything. I would say for like people in general, minus like I've had people come up to me in the past and be like, you don't look like you look like shit, or you don't look like you're feeling well, are you getting sick? And just a matter of letting them know, like, I don't feel good, but I'm not sick in a way like that you would get sick. I am sick in my own way where it's not contagious to you, so it shouldn't be something you have to worry about or bug me about as much. And for doctors, just because one patient that you treat, like this treatment works really well for them, doesn't mean that it's going to work well for everyone. Or how like Maura said with the imaging, especially with like blood tests and with some other testing, they shouldn't just believe the result of those. They should believe us, because we're the ones experiencing these symptoms and who have these conditions. Because yeah, a blood test might say one day that you have something and the next day might not, but that doesn't mean that you don't have this condition or you don't have that symptom.
Definitely true, especially when it comes to chronic pain conditions. We will group our next few questions together. So what advice would you give to someone who is newly diagnosed or is suspected of having your condition?
I think to listen to yourself, to like believe yourself first and foremost. To you have to learn. And I know a lot of times they'll say like, but you stay off the internet, do this, but like if you have an idea of what you have, or you know what you have, it's okay to be on the internet to learn about it. It's more like if you just have a random cough and then someone types cough and then they think they're dying of cancer. But when you know what you have, it's important to know what's going on with your body and what it's doing. I think that's the most important thing, is to listen to yourself and to be the best advocate possible.
Definitely.
Yeah, I agree. Just being your own best advocate. Especially in new appointments, like we already talked about, having someone supportive there, whether it be a parent, a spouse, a friend, even, who can kind of back you up. Oh, and I had a last one, and I thought it was a good one too.
Katie, do you want to go while Mara's
Yeah.
thinking?
Never give up on your dreams. Keep pushing no matter how hard it might be. And don't let anyone tell you there isn't something that you can't do. There's always new ways to adapt and still get the job done. You just might have to take more time because nothing is impossible.
I literally had it and it doesn't want to be heard.
Did you feel it flying away?
Yeah.
Yep. It's the best feeling, right?
Yeah, it really is. Yeah, I give up.
For no matter what, just keep pushing on. It's not just like keep pushing on and don't give up on yourself. You know your body best, and definitely build a support group of people you could trust, whether it's family, friends, even if it's someone that you know or met through like a support group or something that has similar conditions that you could bounce ideas off of. Just build a support group that you could trust.
Sorry, I
No,
finally
you go.
remembered. I think, oh my gosh, did it happen again? Never feel bad for doing what you need to do for your body. If you need to rest, even if it is inconvenient for someone else, don't feel super bad. Don't like apologize like crazy, like I tend to do, because it's out of your control. Like you don't want to do it, but it's what you need to do to get through the day and to be functional the next day or to not end up in the hospital. So that's all.
I think also, sorry, last thing for me, is to find a balance, because it's good to have like, like when you have support groups for chronic pain, but they can tend to be a lot. It can be helpful in a way, like to maybe if you have something new and you're not sure about it, like you can ask. And if people are experiencing it also, like it at least helps. But sometimes when you go into that, especially in the beginning, when you finally find like a group, like, oh my God, they get me. You go on this rabbit hole and you can be too down too fast. And it can be like, oh my gosh, like now I'm stuck in this, and it becomes your disease or your illness, your pain becomes you. And you're you even with the pain. It's just a little part of you. So to find that balance.
Definitely.
And I would say number one as well, your pain is real, and don't let anyone gaslight you into believing otherwise.
I would say definitely, you are not alone. There are other people out there feeling the same thing you are. And if you can find friends with, similar conditions, so you can, feel that for sure. You can talk to someone, say like, I'm feeling this, and they can say, same. Back at ya.
I almost forgot the most important part of this. Does anyone else have any questions? Anyone listening for any of our guest speakers, or as a general question overall? Feel free to type in the chat or speak up. I should be playing like the Jeopardy song in the meantime. That'd probably get copyrighted. Well, if no one has any questions, I would like. Oh,
You have a question.
Oh,
Thank you.
Thank you.
Thanks, Shayma. Yeah. Just for those who haven't heard of brain fog before. Oh, thank you so much, Anne Marie. And I'm experiencing brain fog. How ironic. I don't know what I was going to say.
I think you were explaining brain fog.
Oh my God. Oh, I love that. So brain fog is when words literally get pulled out of your mouth and you don't really know what you're talking about, and your thoughts go away.
I mean, that can happen to, average people, but especially people who have a condition that either POTS that causes your brain to have less blood, so your brain physically doesn't work as well, or if you have chronic pain and you get painsomnia and you
Or
sleep,
traumatic brain injury.
or that,
Yep.
yes, definitely.
Insert many other things. But,
Or studying too much.
yeah,
Might get that too.
yeah. Well, thank you so much to our guest speakers for coming out and sharing all your experiences with us. We really appreciate your time. And thank you to everyone listening and being active participants in this and being willing to learn and be compassionate towards other people. I think a lot of
Thank you for doing this, Stephanie and Sarah. I think what you guys are doing is incredible. I think you're going to really teach other people. Because I know, like, one, you have your own set of issues, but going to be a doctor, you're going to like change people's lives. So thank you.
That's the hope. I hope I can make an impact. That's why Sarah and I started this. And thank you to all the board members listening. All of this could not be possible without you. All your work behind the scenes to add to everything we do. Very appreciated. Yeah, and board members, please stick around afterwards. But yeah, I think that kind of wraps up tonight. Anyone have any final thoughts?
This was a lot of fun. So thanks, guys.
Of course. Thank you for joining us.